Hello to all students. In this video lecture, we are going to discuss a certain type of headache which is known as migraine. Migraine is a very severe stabbing pain in half section of your head. This is a very severe pain and it comes in the form of a severe attack, and unfortunately, like other mental issues, mental diseases, this disease also does not have complete cure. So we have to treat it with certain medication to avoid the attacks of migraine. First of all, we are going to look at the symptoms. The symptoms of migraine can be divided into four major groups. The first group of symptom is known as prodrome. Prodromes are usually symptoms which starts to appear before the attack of migraine. These symptoms can appear a week before, some hours before, or a month before. So what are these symptoms? Problem concentrating, irritability, depression, trouble sleeping, nausea, fatigue, sensitivity to light, which is also known as photophobia, and muscle stiffness. So these are some important symptoms which can leads towards the migraine attack. After these symptoms, which can stay for a couple of days or for some hours, the second stage of migraine starts, which is known as aura. During the stage of aura, usually the symptoms are psychological. So what are these symptoms? Seeing bright flashing dots, sparkles or light. During a day while you are sitting, your eyes will see bright stars or dots in front of you. So that is very abnormal thing. Blind spot in vision, you are looking at something but you are unable to see it because it comes in your blind spot. So even you are watching something or looking at something and you are not able to see that thing, that means there is something wrong. Tinnitus, sounds in your ears. These sounds can be of rain, of tingling. These sounds are like bells or something else in your ears. Numb or tingling in skin, your skin will become numb, or sometime tingling sensation can be felt in the skin. Your speech will change from normal speech to abnormal speech, temporary vision loss, and changes in your sense of smell and taste. After all these symptoms, you may have or patient may have symptoms acute attack of migraine, which is headache, severe headache in the half side of your head. During the attack, symptoms are sensitivity to light, photophobia, nausea, vomiting, loss of appetite, sweating or chills, pale skin color, fatigue, speech changes, and blurred vision. So these symptoms during the attack can vary from person to person. Some people, they have more severe symptoms in the morning, while as the day sets, the sun sets, the symptom gets better. But every person has different types of symptom depending upon the type of migraine. Then the last stage come after the treatment has been taken, the painkiller has been taken, and the attack is going to stable. Then there is a next stage which is known as postdrome. During postdrome, you can feel some more important symptoms like unable to concentrate, feeling depressed, fatigue, not being able to understand things, and feeling euphoria. So after this all, the attack is over. Now maybe the next attack is going to come after weeks, days, or even months. So now we are going to look at what is the cause of migraine. So the scientists could not find any cause for this disease so far, but there is a nerve which is involved in migraine, which is known as trigeminal nerve. Trigeminal nerves has three branches: ophthalmic nerve, maxillary nerve, and mandibular nerve, which penetrate or innervate in our head region. Any problem in this nerve can cause severe pain in half side of your head, either right or left, can cause migraine. So it depends on certain chemicals like serotonin or other chemicals which may trigger this pain in the head. So now we are going to look at some triggers which are associated with the migraine pain. So these triggers are hormonal changes, stress, certain foods, caffeine, senses, medication, and change in weather may also lead to certain type of migraines. So if a person knows which kind of triggers the migraine pain, so we can avoid the attack of migraine pain by controlling that trigger. For example, if a person has a migraine by drinking coffee, so by stopping the drinking coffee or taking caffeine will help the patient to get better without any medication and can prevent the severe attack of migraine. So there are certain types of migraine which has been diagnosed by doctors. Menstrual migraine is usually in females during menstruation or menstrual cycle. Silent migraine usually does not cause any pain in the head. Vestibular migraine, these symptoms of this migraine are usually associated with ears, and there is a problem in balance of the posture. There is going to be nausea and vomiting. Abdominal migraine is not associated towards head, rather it is associated with the disturbance in the digestive system. Hemiplegic migraine, during this migraine half side of your body will become paralyzed for certain time. After that it will become okay. Ocular migraine symptoms are usually associated with your eyes, as we already mentioned earlier. So if you have a severe headache, that could be a migraine, but properly diagnosis we have to perform certain tests, blood test, MRI, CT scan or EEG. So these tests can finally confirm that a person is having a migraine attack or it is a common headache. Because migraine can be related to aura or migraine can be related without aura. So it depends upon the personality of a patient. So if a person has been diagnosed with migraine, then there are certain medications which are able to control the pain. Because there is no cure, so we can only cure the attack of migraine. Number one, pain relievers, which are usually we can get it from over the counter like acetaminophen or ibuprofen or some other kind of medications which can helps to relieve the severe pain. If these pain relievers do not work, then we have to see a doctor to prescribe some stronger medication like NSAID. These medications are anti-inflammatory medicines, and like Celebrex, which are also known as Celecoxib. So these medications can help to maintain or improve the pain of a person. Triptans, almotriptan for example, also helps to balance the chemicals in your brain to stop the severity of the headache. CGRP receptor antagonist, these are certain medications which work against a chemical CGPR in your brain, for example Nurtec, and helps to relieve the migraine. Lasmiditan, also known as Revo, these medications, and ergotamine, which is obtained from a certain fungus which comes in the name of caforgot. These both medications also works to better or to maintain the certain chemicals in your brain which are causing the migraine pain, to prevent you from being attacked by a severe attack of migraine. So prevention is better than cure. So a person should also treat it with prescription medicines for migraine, but at the same time a patient should also know that what kind of triggers can make the severity of the headache or make severe attack of migraine. So if we can avoid those triggers, then maybe we have a lesser amount of attacks of migraine in the future along with prescription medication. That's all for today. See you in the next lecture.